For long-lasting and sustainable development of any nation, there must be the peace, and there is no option of peace. Prevention and conflict resolution and enhancing the peace is one of the focus area of Rotary. Rotary International has put its one of the aspect area, prevention and conflict resolution and enhancing the peace. Rotary International and Rotary District is creating the peace leader all around the world, and Nepal has been also benefited by this work of the Rotary International. Nepal emerging after decade-long civil war, peace is the maintaining the normalcy between the two people, two institutions that is directly or indirectly affected by armed conflict. There are 6 Rotary Peace Centers at the 7 prestigious universities all around the world. For the post-conflict management and the starting of the long-lasting peace in Nepal, Rotary District 292 and its club has been supporting the peace and conflict resolution scholarship for the master degree for the deserved Nepali candidates, so that they get well trained and skillful, and when they back, they will contribute for the maintaining the peace in Nepal.
Nepal is in last 2 decades, in every aspect there is significant changes are occurring that is applied in the health sector as well. If we see till last 2 decades ago, we are quite burdened of communicable diseases. Now with urbanization and Nepalese people are traveling to other countries as well, they are copying their habits and economically as well, or the financial as well. They are quite now it is improving. So the food habits and the daily life is changing, that leading to the little obesity as well. What I mean to say, earlier we are quite burdened with the communicable disease, for example diarrhea, pneumonia, or the dysentery, typhoid, meningitis. These sort of quite a lot of communicable diseases are occurring. Now in the meantime, now communicable diseases like the diabetes, hypertension, obesity, hyperlipidemia, uric acid, such problem also gradually increase, thus leading to the more number of deaths or the mortality due to this non-communicable disease also gradually increasing. Now regarding the role of Rotary in this treatment part, in the micro level, in community area, they are regularly providing the quite a significant number of mobile health camps. So these are ultimately directly helping to the community people. And in some part of Nepal, I do know where Rotary has organized the camps where they never seen doctors or the medical doctors or the even nurses as well. So with the help of Rotary, they have got opportunity, get treatment in their doorstep. Not only that one, I do know certain examples. Rotary has provided high cost newer machines which help in the this uplifting the treatment part in the different hospitals of the Nepal, like the Dhulekal Hospital or the Reka Masunaga Hospital. In this, they have provided quite a newer instrument which help in the treatment, which make it fast, and helps in the evidence-based health practice as well. So Rotary, in the one aspect, they are going to the community level and do the needful for the local people. In the meantime, whoever coming to the hospital as well, they are also getting treatment indirectly with the help of Rotary as well.
Water and sanitation is one of the 6 focus area of Rotary International. the situation is such that about 2.6 billion people worldwide, they lack adequate sanitation, and about 884 billion people, they lack clean drinking water. And in the case of Nepal, about the coverage of water supply is about 87% and sanitation is about 65%. We all know that about 6,000 children die each year because of the disease like diarrhea. So this is a very alarming situation all over the world, including in Nepal. Rotary Nepal is giving priority, big emphasis on water and sanitation. Now Rotary District 392 has a plan to construct about 1,000 permanent low-cost houses and about 140 schools where water and sanitation is a main component. Like one of the cluster is Brunjuli, which is under construction. There also we are giving good water supply system. We have constructing overhead tank and house-to-house connection system. And we are constructing about 55 houses with toilets. Similarly, there is another cluster now under construction, that is at Soulbesi in Kabwe district. So there are so many projects and so many involvement of Rotarians in this sector. As I said, our main focus is water and sanitation because 6,000 children per day they die because of diarrhea disease, that is because of lack of proper water supply and sanitation system.
Maternal and child health is a very important issue in the Rotary District 3292. Well, this is the first time I'm the woman governor for the district, and I'm very happy to say that I'm getting the opportunity to work in the project which is one of the focus areas of the Rotary, maternal and child health. Rotary has tried very hard to create awareness in the different communities. This is going to be one of the most important programs that will happen during my year 2016 and 17, because we believe that every life is important, and even the woman, she has to also face life, and she has to be brave enough and be healthy to face everything that comes and everything that will bar her coming out into the world. We have received help from the government as well, and we, before going into this maternal and child health, have spoken to the ministries regarding how they would support us. Rotary, no doubt, is a voluntary organization, but we have worked for many years and we are trying to see that we can do better and better every year. But in order to save lives, we have to be very careful as to how we can get them to understand that their lives can be saved if they really understand how we run the programs and how we can create awareness amongst the women. Now we have in our district 100 clubs to our district, added to our district. So we do hope that each of these clubs will do something during this year to help the mother and child infant mortality as well. But now we can really boast that we don't have much of the infant mortality as we used to have, because now the people are getting more and more educated. But we can always do even more, and the more we can do, the more we can save the lives of the people and definitely keep the mothers healthy as well.
Nepal's developmental challenges are high illiteracy rate. Nepal's total population above 5 years is 23 million and total literate population is 15 million, which is 65.9%. This means 34% populations are illiterate. who could not read, write and understand sign languages and simple mathematical calculations. Because of this educational disparity, the development efforts are limiting. Rotary International District 3292 initiating total literacy project based in teach model to enhance the quality of education in public school of Nepal. Rotarian of South Asia region are committed to help school support program adopting one club, one school based in teach model. The objective of this project is to improve the educational standard in the government schools where the quality of educational standard is lowering every year. Despite government spending huge amount of money in educational sectors, the outcome have not been the same as targeted. Our target of the project is to deliver it to 20 districts and 100 public schools by involving more than 30 Rotary clubs around Nepal where the educational standard is really poor. During earthquake in 2015 April in Nepal, more than 4,000 schools have been damaged and more than 13,000 classrooms are damaged. And Rotary is working to help Ministry of Education to rebuild and reconstruction the schools, and we have an agreement with the government of Nepal, Ministry of Education and Rotary International District 3292 and the Chamber of Commerce. So three tripartite agreements come in force to build 140 schools completely and furnishing and all the equipment will be provided from Rotary.
One of the focus areas of Rotary International is economic and community development, in which field Nepal has been pretty active. So apart from the recent earthquake and the calamity facing Nepal and the embargoes facing Nepal and all the problems which we had, we still managed to do a lot in community development and economic development. One of our basic projects in most of the clubs, right now we're adding up to about 100 clubs, is about microfinancing. Microfinancing has reached a high level in Nepal, and that has really helped the ground root level people, for their employment generation, self-employment and doing small work and getting the finance for it. Apart from that, we have also been able to create a lot of employment generation through projects done by various clubs in our economy. Though ours is a basically agricultural and service-based economy, we are trying to focus most on service industries here in Nepal because of the giving skills to people, vocational training to people and training them in various aspects of earning their own livelihood with their own skills. So a lot of the clubs have been working jointly or in many villages scattered all over Nepal, helping people to come out of agro-based industries, develop skills and go into service sector and maybe into small industries later on as a cooperative society. And Rotary as such plays a very prominent role. With all its 100 clubs scattered in 75 districts in Nepal, we are working together in a large, extensive fashion to cover the whole of Nepal and even small remote villages which have not been yet reached by the government has been reached by Rotary.
We used to have in Nepal disaster in monsoon flood and in summertime fire. Last year on April 25, we have a big earthquake after 82 years. It's a big and casualty of more than 9,000 people, and there are so many houses damaged partially and completely, private and public houses. The effect of that earthquake has 31 districts affected. Out of 14 districts are heavily affected. immediately after earthquake on April 25th, Rotary clubs, almost all clubs in Nepal, involved in the emergency relief program going to in different part of the district by the different clubs. After emergency relief, we have a program of constructing temporary shelters in different parts, means 14 districts that were heavily affected by the earthquake. About 4,000 temporary shelters were constructed by the Rotary Earthquake Committee. And then after August, we are trying to come up with at least 1,000 low-cost permanent houses and 140 schools within these 14 districts. We are trying to construct 10 primary schools in each district. That means 14 districts is 140 schools. For that purpose, we will be trying to have a global grant. We are getting so many donation from the friendly country and friendly Rotary. We have already started constructing low-cost house in 3 districts. One is Majigaon, Sindhu Palchok. Second is another district, Kabre, Madevstan, and Charubesi village. There we are constructing 73 houses, and another district, Lalitpur, we are in Brunchali village. In Sindhu Palchok district, Majigaon, we have constructed 46 houses and 1 community hall, which has already been completed and handed over to the victims. We have already collected $1.5 million, and the total cost for the 1,000 house and 140 school software part is $9.2 million. We are looking for cooperation and assistance from different Rotary district and Rotary friends and donor countries to come forward for the purpose of reconstruction and rehabilitation of the earthquake victim. And so it's not predictable, but even this flood and fire in different part of the country used to have every year, and we in the Rotary District 3292 we have created a disaster relief committee also for this every year recurring disaster.